Okay, hello. Welcome everybody to ALS United Connecticut's Ask the Expert. We have Leah Goggins today. She's an RN advocate with Solace, and I was able to connect with Leah recently because she called to kind of brainstorm about a mutual family, and it led to me not even being aware of the service and wanting to make sure the rest of our community and families knew about it, and she graciously offered to educate us all and the services that Solace can provide to people in our within our ALS community. So I will kick it off to Leah.
Hello, hello. I'm so excited that I get to share with you all about Solace. I found Solace, like a lot of people will find Solace. I found it on Facebook and I thought, well, this is interesting. And the name up, so you can go to the first slide if you want. I have an assistant. There it is. All right. Okay. You want to go to the next one? Number 2. There we go. So I found Solace, and when I did a little bit of research on them, I realized what an opportunity. As a nurse, I've been a nurse a long time. I live here in Connecticut, and I've done lots of different things. I've been a nurse for over 20 years, tons of experience. I worked in a skilled nursing facility actually during COVID. That was a challenge. That was a big challenge. Visiting nursing is my most recent experience. I was with a Connecticut nursing agency, and I think that the thing that I gravitated to Solace the most was that as a visiting nurse or anybody really in any kind of clinical field, you know what it's like. You go in, you have so much time, and you get out. And I felt always as though my patients weren't really getting all of what I could give to them. So when I found the company, and I'll dig into it just a little bit deeper, obviously, you'll see what I mean. And I hope that you catch the excitement in my voice as to what I get to do. So, like I said, skilled nursing facilities, visiting nursing. I worked in the emergency room, Griffin Hospital. And I was even a daycare nurse. That was really interesting. Little people running around but there's all sorts of things in every one of the jobs. Obviously, there's a lot of research. There's a lot of making sure that you're connecting people with resources that they need, right? And the best part of what I get to do is that I get to take everything that I've done over the 20 years and I bring them here. And I don't just have Connecticut patients and I don't just have ALS clients. It's all different diseases. So I have people in Washington, there's advocates that have people in Hawaii. So we can really, we're all over and we support them. So we're all experiencing caring for patients with different diagnoses, and some of the things, just some of the things that I've had experience in treating as a nurse is cancer patients, chronic pain, and and I'm sure you all know that chronic pain is a huge, it can be a really big piece of the puzzle, and treating pain with ALS. And then sometimes wounds can be into that too. So I've been a wound care nurse, cardiac conditions, chronic illnesses, so lots of things. The list is kind of long, but you get the idea. But one of the things that I think is most important, as with most healthcare providers recognize, it's not just the person, it's not just that one disease, right? You have to take in the whole picture because there's a lot of things that a client or patient is dealing with. It's not just ALS. It's not just the diagnosis, but it's housing. It's, are the bills going to get paid? I can't work anymore. My caregiver can't work anymore. Gee whiz, I've got some new medications. I don't even know what they are, and I don't even know how I'm going to pay for them. All of these unanswered questions go into the mix, right? They all go into that recipe of just the fatigue of getting through each day. And some of my clients, some of my patients are doing this all by themselves, with limited support. And one of the things that they've gone back in Solace, so now Solace is a fairly new company, like I said. And when they've done surveys, um, our patients, our clients are really happy. They feel as though we're really meeting a need. So if you want to go to that next screen, that'd be great. Thanks, Amy. So here's our mission: empower patients, improve outcomes, and restore the promise of the United States healthcare system. So I think it's kind of like a no-brainer, you can see. But I think one of the most important things that I can tell to my patients is that I want to empower you. I want to give you back some power when things kind of feel like they've been taken from you. It's this great big diagnosis, right? That feels like it's out of control. And but I want to make sure that you recognize you. I'm going to empower you. I want to help you, and I want to improve your outcomes. While maybe it's finding obviously the right medication, the right provider, the right treatment, and the healthcare system is broken. I don't think I need to explain that one. I think that's kind
Hmm.
of like self-explanatory, right? So
Yeah.
here we are. That's why Solace just kind of spoke to me. Next screen, be super. All right. So I'm going to just read through what I do, and then in the next screen, I'm going to elaborate. So I make a lot of phone calls, obviously, phone calls, doctors, and all these things. I make appointments. I do a lot of research. That was one of the things I think that I reached out to you with Michelle, right? Was just grants and funds that, we're all kind of working together. Um, and I help with filling out forms. I've helped people get medical equipment. I've helped people get government benefits. But I really think that one of the key pieces is I listen to what matters to you. And there are times when navigating through the medical needs seem overwhelming, but I'm here to help you. Can you go to the next screen? All right. So now it's going to be a little redundant because you just saw the last one, but now I'm going to dig into it. So I make lots of phone calls to doctors. Say you have a doctor, right? And the doctor, and that's one of the first things I ask you: who are your providers? Because we want to make sure that we put them in your chart. Um, do you like them? And sometimes people say, I love my doctor. And then sometimes people are like, yeah, no, I really don't like them. So that's fine, because I want to make sure that you feel as though the doctor that you have is meeting your needs, and they're listening, because sometimes you don't always get that, right? You may say, oh, he's really smart, but man, he just rushes me in there, or she just doesn't take the time. So I could find you a new physician and you're like, I really didn't like that one. I'm like, all right, guess what? You're in charge. I work for you. Let's move on. We'll find somebody new. Um, and that is helpful because sometimes people feel a little trapped in the system. But don't think that when I find a doctor that, number one, the first thing I'm doing is making sure that they're covered by your insurance. Because anybody can open up, or go on the computer and open up a phone book. That makes me sound dated. But go into the computer and find somebody, right? But are they covered by your insurance? Um, how soon are they seeing people? Are they seeing people next week? Or are they seeing people next year, right? Then I do a deep dive on that physician. I want to make sure that, what do the reviews look like? Do they have anything against their license? I want to make sure that when I come to you and I say, this doctor looks really great, he's got really great reviews, his record looks super, that you can trust when I come to you and I find somebody, that I've done some research for you. I make appointments. Sometimes people are juggling a million different providers, or even just a couple can seem overwhelming, right? So I can make appointments and we'll figure it out. Like, give me a date that you aren't available. But then the other thing that people have really found benefit with is that I can attend the visit with you over the phone. You put me on speaker, and then I take notes for you. Because if you're in an anxiety moment, the hardest thing to do when you walk into a doctor's office, and there's a lot of white coat syndrome, everybody has it, is really retaining that information. Because when you're anxious, it's hard to listen to things and then to remember. So I'll be in the background taking notes. Sometimes my patients will say, listen, jump in with a question, or ahead of time, we make a little cheat sheet to say, listen, let's go over the questions you really want to make sure that you get covered. Because sometimes you go into a doctor's appointment and you're like, rats, I forgot to ask them that. So we'll have a list. We'll say, okay, what is the most important things you want to get covered? And then they'll come out of it. And then what I like to do is I'll email you, or I can even text you the notes that I've taken. Or say they give you a test. They're like, I have no idea what that test is. Or what is the test? What is it for? What do I have to prepare for? I dig all that out for you and I hand it to you. Um, Back to researching funds and grants. That's how I connected with Michelle, right? Um, and I search all over the United States. I've talked to people, all sorts of different research and grants and helping them find financings. And it's not just for medication, but I'll get into that more. The other piece of the puzzle that's really can be time consuming is filling out forms. Nobody likes to fill out forms. And we have a rule here at Solace that we don't give homework. I'm never going to say, listen, here's a doctor or here's a form, fill it out. Sometimes people, they enjoy being independent and doing their own thing. And then some people are like, can you just do this for me? Absolutely. I want to do whatever you want me to do. So I can help fill out forms. If they can do it, if I have the information and it's pretty simple, I'll do it and I'll email it out. And sometimes with grants, I've done that because some of the basic information I already have. And sometimes I may need to do it with you. We'll kind of tag team it, but I'll fill it all in and I'll send it out. I have helped people receive medical equipment, like walkers, wheelchairs, scooters, and sometimes that's tricky because there's rules in Medicare. I'm sure you guys know that you can only get something every 5 years. I think one of the most exciting things I just did just recently too. I have this sweet little lady. She lives in Kansas, I believe. She lives in a long-term care facility. And when you're in long-term care, we can be a Solace Advocate for you, which is a really new thing that we get to do. It's not just people at home, but she had a power wheelchair that her family bought for her secondhand. She had it when she went in there, and in the facility, when you have Medicare, Medicaid, all of your funds go to help pay for your room and board, right? And the option for her was Medicare will get you a regular manual wheelchair, which and there's enough people around that can roll you around. And that was her option. So she 84, I'm not kidding, this is the best story ever. She was on Facebook looking for something exciting. That's what she told me. I was fell over. That was so funny. I'm like, how did you find it? I was on Facebook, she said, looking for something exciting. And I found Solace and she applied. So she was really in tears though when she came to me. And because, putting someone in a wheelchair at 84 and waiting for somebody to come and move you around. So anyway, long story short, I reached out to the local Lions Club in her area, and I know the Lions Club are kind of they're known for like providing glasses, eyeglasses. But us advocates, we're rather tenacious. If I see that you do things that you can do grants and funds and help, I call them up. I gave them the story, obviously with her permission, and said, listen, I've got this sweet little lady. She's right in your town. This is the deal. And they're like, well, let's get back to you. Then the next piece of the puzzle was I found the durable medical equipment company in her area. They already serviced her little facility. They were well versed and they knew each other, right? Because I started out with, going down the line and the administrator, no, 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 what we do for one, we have to do for others. I knew that was a closed door, but I keep knocking till I get some answers. And I told the story to the medical equipment, and I talked this really cool young guy named Cole. Cole's my new BFF. He just doesn't know it. And he went to his boss and he told him the story. And they are willing to provide a power wheelchair for this sweet little lady who has no family in a long-term care facility for whatever the Lions Club is going to grant her. It was like I felt like I just won the lottery. I'm not even kidding. That's how great it felt. And when I got to tell her that she'll have a new power wheelchair within a couple of weeks, it was great. It was so rewarding. The best, the best. So that's my story on power wheelchairs. And those are tricky to get because if you've ever tried to get a power wheelchair, there's a lot of pieces of the puzzle. And you have to, obviously have a doctor's appointment, but we know all the checklists. We know everything that you need to do. And that's what I do. I make the appointments, I call the providers, I call the insurance company, I call the medical supply company, and we hand it to you. So, but most of all, I listen to what matters to you. That's it. I love to listen. I'm talking a mile a minute right now, but trust me, when you begin to share with me who you are, I take it very seriously, and I feel it an honor that I get to help you at one of the times where you may need me the most. So, next slide, please. Okay. So, just a couple things. A little bit is redundant, but I'll go over it a little bit. I've helped patients find help with chronic pain, and find a facility. One of the hardest cases that I had was a little lady that had um, a really bad provider, and she was in the middle of nowhere, in the middle of the country, and her provider was not good. Not everybody's stellar. I know that, sadly, and didn't like the patient, thought she was too needy, whatever. And she was in chronic debilitating pain with lots of things. And the provider said, guess what? I'm not going to provide for you anymore, and shut the door. So when I got this advocate who came to me, she was in a meltdown, panic, and who could blame her? She had less than 30 days to find somebody that was going to give her pain management. She had chronic pain and only had about 2 weeks left. So um, I just kind of went into, like, I don't know, pit bull mode. Got a hold of the physician and had a little chit chat, and basically just said who I was, sent her who we are, and we have consent forms that we can talk to your providers with your permission. So I think what happened is that she realized that there was someone with eyes on her, someone in the medical field that was watching this poor behavior on her part. She agreed to extend to give me time to find a pain management provider, let her renew her meds for the month. That extended my time. And then I hit the pavement, on the phone and on the computer, and found a medical provider that said, absolutely, this shouldn't have happened to you. And she's living pain free. So that for me was a huge win. That was huge for me. And then physical therapists. Um, Sometimes people will want a physical therapist and they don't know how to go about getting them. And visiting nursing is a great place to start. So, but with visiting nursing, they have nurses, there's physical therapists, OT, the whole deal. But there's a limited time. And at the end of the day, their service is done, right? And you have to get renewed, or they say you've plateaued, I can't help you anymore. And I have found companies. There's one I use in particular called Fox Rehab that I know it has services here in Connecticut, who don't require you to be homebound. So the little pieces of the puzzle I think that I took as a visiting nurse, I can throw them into that mix here too, that not everybody is homebound. People want to get out, you want to live your best life, and let's find therapists that can help you where you are, right? And the Fox Rehab people, there's another company, but I work with them the most. um, they don't require that, and there's no cutoff time. They work with you until you don't need them anymore. Um, Another company that I love that's all over the United States is called Vimed, and they're a respiratory therapy company. And they go in and they have a respiratory therapist that can go into your home and treat you. So while stepping out of your home may be really difficult and taxing based on where you are medically, right, and physically, there's resources that I can help you find that can treat you in the home, or resources if you're able to outside. So I want to help you take control of the chronic illness. That's really where I believe is the most empowering. I want to give you back some control. I want to help you navigate a new diagnosis. Sometimes people will say, listen, I have this, but now I just got this added to it. Don't worry. I'm going to do the same research. I'm going to do the same help. I'm going to help you get through all the channels. Or maybe you're new to ALS and you just don't know where to start. I'm going to be your listening ear. I'm going to review, and I'm going to research your medication. What if it's a medication you've never heard of? Or what if it's super expensive? Because some of them are. I promise you, I'm going to help you find ways. There's all different ways to afford them. Medicare did come out with a new rule this year. People don't always know that they cap you out. You can't pay more. I think it was $2,000 out of pocket through Medicare. Some people don't know that, and they're paying thousands of dollars. But most of the meds that I found with my ALS patients, they're covered, and there's different foundations that can help you with that. And the other thing is, I help you for as long as you need me. I don't rush you off. I don't say, listen, you got 30 days with me, sister. I'm going. It's as long as you need me. Some people say, all I want is a scooter, or all I want is a power wheelchair, all I want is a pain management. And then that's fine. And then we move you to what we call is an inactive. We put you into our inactive, meaning you're still in the back of my file, and you may text me. I've got a little lady out in Washington, says, listen, I'll let you know when I need you. She sends me a text. I move her back into active. And then with whatever she comes up with, that's what I do. So as long as you need me, I'm here. I'm not going anywhere. Next slide, please. This is who we are. We are a large network of healthcare professionals, with physicians, pharmacists, and nurses, and we all work together to find resources for you. One of the things that we do is that we have a group chat among advocates, and somebody may put in there, listen, I've got somebody in New York City, and they really need to have this access, and we'll say, oh, I got this resource in New York City, because we're based all over the United States. So we share our links. We all get excited when we find our links. It may sound a little corny, but we do. um, I found people that help with housework, depending on the diagnosis. There's actually a company that will deliver a free homemade lasagna dinner. Score. I don't know about you, but if the world's like a little crummy, lasagna usually works for me. But there is, and they're volunteers who make lasagna dinners and deliver them to your door. That's a score. I feel like that's a score. When we find a great resource for our patients, we like to share it with each other in our community group chat, and we have a little running list, and it's a win. Next, please. So we serve patients on Medicare, and before you even get an advocate like me, you're gonna talk to one of the doctors at Solace. And what they do is, first of all, they're going to confirm that you're covered, and I'm free. It's a covered service, and most people don't know that it's a free service. It doesn't cost you anything. And guess what? Before you go any farther, they're going to make sure that you know. And at the top of your screen in your chart on my side, it says fully covered, so I can reassure you. And like I said before, patients all over the United States. I'm ready. The next one. And it's not just only Medicare. I do have patients that have Medicare and regular insurance. They have a supplemental Medicaid, but Medicare is the umbrella that we come under. So once you call in and you speak with one of the doctors, a few things are going to happen. A care plan is started for you. It's tailor made based only on you. You're not a cookie cutter, right? We want to make it just what you want, what you say that you need help with. And then it can evolve and change because, life changes. You may find, oh, I got this and now this is happening to me, or, oh my goodness, everything's going along and then all of a sudden your car dies. How are you going to pay for that? We find a lot of things for people. It's not just medication, obviously. Local food banks. We talked about pain management, but you get to decide how we help you. Sometimes people are like, no, I want to do this one on my own. I keep on telling my patients, I work for you. Whatever you want me to help you with is what I'm going to help you with. So you're matched with an advocate. It doesn't have anything to do with location. It's just based on the nurse's specialty experience. You can decide. We can either do, some of my patients like to do video visits. Some are like, no, I just want a phone call, but you get to decide that. We're always going to ask you. Next, please. All right. So before I even talk to you, I'm going to get a little notice from Solace, and it actually says, congratulations, you have a new advocate patient. And then I read through all of the notes that the doctors put together, and I see, obviously what you want help with. I'm already going to dig into the diagnosis. I'm going to look at whatever medications you provide, tell the doctor that you have. And before I even say hello to you, I've already, hopefully, getting things ready and prepared that I can find, said, oh, by the way, this might really help you quick. So the first visit, as you know, with any doctor's appointment is going to take a little bit longer. There's a bunch of questions. I want to get to know you. I want to feel as though that you can trust me, and I want to get the big picture of your life, right? We never want you to feel rushed. That's so important. We take our time. I've got some people that are like 15 minutes in. Thanks a bunch, Leah. I'm good. I'm all set. Talk to you in a week. And I've got some that are just like, um, they just need me to go over everything with them. They could take an hour. So really it's up to you. Our schedules, we figure out whatever's compatible, not everybody's an early bird. I am an early bird, I will confess. Um, but sometimes, you want to get your day started nice and early. And all the advocates have different hours. That kind of goes into how you get matched with someone. Personally, I work 8 to 4, Monday through Friday. But we have advocates that are like this is their second job and they do evenings, they do weekends. So it doesn't really matter. It's based on, your needs and that as well. I'm ready for the next one. So we collaborate obviously with social workers, advocates, physical therapists, OT, visiting nursing. I've reached out to visiting nursing, your doctors, nationwide foundations, lots of emails and phone calls. I'll sit on Medicare. I'll sit on the phone call and be on hold with Medicare so you don't have to. I call insurance companies. Calling Medicare is a challenge, and we want to make sure that you don't have to do all that. I do that for you. When we combine our resources, we can go farther faster. Nationwide databases really do help us cover a lot of ground. And I make the phone calls. So you save your energy and time for the things that you want to. And I'm here for you. Next slide, please. And really, truly, nothing makes me happier than finding just the right resource. I've helped people find, most recently, I helped somebody find funds to cover their rent. Their rent is $1,000 a month, and I helped them find 3 months worth of rent. That was a huge win for me, for them and for me. It felt so rewarding. I want to help you. Um, it's not a given that I can help you, but man, I'm going to do my best to find whatever I can. So that one was really exciting. Um, we all have medical backgrounds and we bring all that to the table. And we're a large and growing group of advocates. We're going crazy right now in our growth at Solace. And like I said, I started in November and they're hiring like crazy. So we're a large group that can, we want to help you live your best life. And my goal and mission is to make sure you have what you need, right? To manage your healthcare needs and your goals. Next, please. I think look, any questions? I've talked long enough, and now your voice is the voice